I am now inviting Chloe Wong-Mersereau for a presentation entitled Beyond Transplant Stories, Weaving Community-Based Knowledge in Solid Organ Transplantation Practice through arts-based methods and digital storytelling with patients. So Chloe is a qualitative research trainee with the CDTRP and social work student at McGill University. She completed her master's in anthropology at the University of Toronto, where she began working in qualitative research with Dr. Suze Berkut and Dr. Kelly Fridge. She works with Dr. Shaifali Sandel at the McGill University Health Center on critical qualitative research in kidney transplantation and donation.
Well, thank you everyone for joining us today. We've had some really engaging conversations and presentations today and yesterday that I think will complement and build upon the work that I'll be presenting today, entitled Beyond Transplant Stories, Weaving Community-Based Knowledge in Solid Organ Transplantation Through Arts-Based Methods and Digital Storytelling. So just to situate myself a little bit, I joined the Frictions of Futurity in Transplantation and Cure team in 2021 during my master's in medical anthropology at the University of Toronto. And the Frictions team is an innovative, multidisciplinary team of social scientists, artists, patient partners, and clinicians led by Dr. Suze Berkhout, a psychiatrist and feminist STS scholar based at UHN, and Dr. Kelly Fritsch, a CRIP and disability scholar at the University of Carleton. So as a student in research, I was really interested in looking at multimodal or using multiple ways of understanding people's lived experience with transplantation. But I did not know anything myself about the realities and intricacies that transplant recipients, donors, and caregivers face. And I emphasize this because this is one of the important outcomes of this multi-year and multimodal project, was the importance of relational and community knowledge building throughout the research project. So a little background about why community and arts-based, why is it important? So many of the presentations yesterday that we heard by Dr. Caroline Tate and other presenters really emphasize the importance of engaging community in the process of encouraging awareness, information, and most importantly, trust building regarding transplantation and donation. And so community engaged research gets at describing partnerships between researchers, community members, that is rooted in principles of mutual respect, reciprocity, and engaged in deep collaborations through the co-creation of knowledge. And this can take a variety of forms. So in our case, we were interested in the stories that surround transplantation. And these are often entrenched in biomedical narratives on the gift of life, cure, a second chance, and gratitude. And while these narratives are very important, they also create and set the limits of what can be expressed and what cannot be expressed by recipients through their transplantation journey. And as these narratives are shared and reproduced in public-facing and educational materials given to potential transplant recipients and their families, they can carry a very effective force that compels certain feelings of gratitude while also bulldozing other, perhaps more difficult emotions in the process. So why narratives? Our team grew interested in the power of these narratives and the potential of complexifying narratives through the process of digital storytelling. Narratives are co-created through relations and community, and as limiting as they can be, they also have the potential and power to be a catalyst for change in the culture of transplantation and donation. So digital stories are short movies that use images, videos, voiceover, and narration, joined with editing techniques to share an important story of a person's life. Digital stories are often used to share an experience that may be difficult to articulate through conventional modes of communication. Modes of communication that are often prioritizing one mode of delivery, Whereas the digital stories layer multiple modes. So they layer the visual, the sound, the rhythm, and the narration all together. And digital stories are useful tools for translating human experience and knowledge through these multiple modes. And they can facilitate learning, advocacy, connection, therapeutic healing, depending on the intention of the project. So our aim for this pilot digital storytelling workshop was to complexify the narratives of liver transplant recipients and increase the access and awareness of transplant recipients' psychosocial concerns. So we had 2 groups of liver transplant recipients who participated in our 8-week virtual digital storytelling workshop to create short 2 to 3 minute digital stories about their liver transplant experience. The workshop was facilitated by 3 filmmakers, Fraser Allen Best, who is a documentary filmmaker and a liver transplant recipient himself, Leah Tarachansky, a PhD candidate and journalist in filmmaking and an artist, and Shabnam Sukadev, a PhD candidate in filmmaking, ethnography, and education. So the first 5 liver transplant recipients participated in the winter of 2022 with both group workshops and individual check-in workshops with the filmmakers. And at the end of the workshop, the digital stories were screened and shared with transplant healthcare professionals at the University Health Network in Toronto during a lunch and learn for feedback and reflections with liver transplant recipients, the creators, and the filmmakers as well. In the summer of 2023, a second group was recruited with more liver transplant participants, and the participants from the first group were invited back to share their experience through the digital storytelling process with the new participants to ease any anxiety and fears around the creative process. So both groups were provided with many creative prompts to begin the process, but the final story, as well as the audience, was self-selected, and the audience and viewer of the digital story was entirely their choice. So since the digital storytelling workshops, we've held several screening events and ongoing conversations with liver transplant, the recipients who created the stories, to collaborate, reflect, and share back their lived experience with transplantation, as well as the knowledge that they built in the digital storytelling process. So next, I'd like to share one of the digital stories. It's a short 2 to 3 minute video, just to give you a sense of what they look like.
My name is Bill Stearman. I am a quilt maker and a storyteller. I'm also 2 years post-liver transplant. Recently, I went with my daughter and her family to my grandson's grade 8 graduation. Watching my grandson and all the other graduates getting the rewards, I was moved to tears. When I thought about it, I realized that before my transplant, after my diagnosis of liver cancer, I wasn't expected to be here. The notion was that I wouldn't be alive, and if I was alive, I wouldn't be able to sit through something like this. And here I was, alive and well, sitting with my daughter beside me, and my daughter's the one who gave me the liver, and I just wept. I am far more emotional. I don't try to hide the fact that I have these emotions. I mean, I feel everything. Every emotion is stronger and more intense than it ever was before. I appreciate everything so much more. It's all just so incredibly wonderful, and I am just filled with absolute gratitude. I want recipients to know that you will be different and your life will change. You'll change in ways that people can't prepare you for, but it's all good. After living through a liver transplant, there's nothing to be afraid of anymore. I am so grateful for every day that I have, every day that is new. I'm not the same person that I was before, but I'm here doing things, feeling healthy, and I am happier than I've ever been in my life.
So Bill's story is one of 8 digital stories that were created. And for the interest of time, I couldn't show all 8. It was very hard to choose just one. But although each story is different, they are simultaneously layers and patches of a shared story that's weaved together through the digital storytelling process. And what we learned about digital stories is that it contributes to a more holistic understanding of transplant recipients and their experience beyond their transplanted organs, beyond their sodium MELD scored. And when the digital stories were shared with transplant coordinators, social workers, hepatologists, and specialists, they described how focused they had been on the success of the transplanted organ and on the illness that they forgot their patients were people with lives outside of the hospital. And so the digital stories became a reminder of the personhood of the patients. This speaks to the relational power of digital stories between patients, families, donors, and healthcare professionals. And one participant created their digital story as a letter to their imagined donor. And the digital story was a way for them to express everything that they might want to express to that donor. And throughout the first pilot workshop, the timing of the study ran through COVID-19 pandemic, and liver transplant recipients were very isolated, and many had never met other transplant recipients. So there was an immediate camaraderie that was shared and a strong desire for the community building and creating a space for people to share their experience and listen to one another. So taking this into consideration, we directly built that into the second workshop, the second group, and created that space for relational and community building among liver transplant recipients. This was very important because it created a kind of supportive and trusting space for participants to reopen really emotionally raw moments from their experience, moments that participants thought they had already dealt with, but as they dove back into their archives, their photos, and their memories, they found that the emotions came flooding back. And while digital storytelling affords participants a way of reclaiming their narratives, their subjectivity, and personhood, by engaging in this co-creation process, we have to keep in mind of who these stories are shared with and why. And the multiplicity of the experiences here in all of the 8 digital stories speaks to the fact that this is not a single narrative, that there are emotionally complex narratives that layer on and build together. And the community-based knowledge that was created with and through the liver transplant recipients for their chosen audiences was specifically designated for future. Some were for future liver transplant recipients, others were for their donors, their families, their children, as well as for themselves. So to conclude, research has shown that a higher level of community participation builds greater knowledge and community capacity for implementing research and a greater likelihood of applying research into policy and practice. So by combining community and arts-based approaches to the production of knowledge through patient-partner storytelling, we can shift conversations to expand the stories we tell about transplantation from individual pieces of a story to a collective whole without losing people's individual voices in the process. And beyond the 8 digital stories that were created, the digital storytelling process engaged liver transplant recipients in this community-based knowledge production by exploring multiple modes, so the sound, the visual, the narrative, and poetry of transplantation. So as the team of filmmakers, researchers, and clinicians and liver transplant recipients, we all learned from one another and created this community knowledge about transplantation through very deep collaborations, trust, and care that was put into 3 years of this project. In terms of our next steps, our team is in the process of archiving these digital stories with the Concordia Center for Oral History and Digital Storytelling, and hopes to develop ways to embed them into the education platforms for potential liver transplant recipients at the UHN. And this was a desire expressed by many recipients to share their knowledge with future recipients, their families, and donors. So with that, I just want to thank our amazing team, the liver transplant recipients, and the CDTRP for their support.
Thanks so much, Chloe. Now we can open up to the floor for any questions. Thanks for presenting. This is fantastic work and such rich story in such short time. How long does it take you to create one of these videos, like from start to finish? I'm just wondering, and there's a lot of editing involved in the things.
Yeah, so to clarify, I didn't make these videos. So there were 3 filmmakers, and one filmmaker was paired with each of the transplant recipients, and they worked over the course of 8 weeks. So it was like a 8-week workshop. Oh, okay. Is that good? Oh. Oh, okay, okay. Yeah, so it was an 8-week workshop. And then I think overall it took a good part of like a year to prepare for the digital storytelling process, but the actual production of the videos took 8 weeks. Yeah. There was a question online.
Yeah. Hello? Okay. So the first question by Sir Paul Vincent is, are there any methods in particular that you used or planning that you used to assess the impact of your work? And then, are there any methods in particular that you used or planning to use to Oh, it's the same question. Yeah.
Okay, so through the lunch and learn that I talked about with the healthcare professionals, it was framed as an impact screening. So we didn't conduct surveys on impact, but we mostly collected kind of oral feedback, people's first impressions about it. We had some prompting questions to discuss, the impact of the videos on the clinicians, and the transplant recipients were there as well. So it was more of a kind of ethnographic and qualitative impact study.
Thank you. It's great work. You mentioned the impact potentially on the clinicians. I think it would be useful to assess the impact both on the clinicians and on the participants. And a couple of questions is that, do you plan, because you mentioned that this would be part of patient education, would you think that this would be also part of nurse and coordinator and clinician education as well? Because it seems that we do lose that perspective that the patient is a human being, and can we somehow go back to that notion? And the other thing is that, would you see a place for this as an ongoing activity post-transplant to, again, co-create with the clinicians and a kind of an alternative clinic space post-recovery or during recovery? Kind of a club for the patients. And I don't know if the hospital, the transplant management is interested in potentially providing resources, but I think, again, assessing the impact may help you convince people that this is a worthwhile endeavor.
Absolutely. No, thank you for the questions. I think the point about education for healthcare professionals and clinicians is another really important avenue that we're kind of exploring through the connections at UHN, and the Living Center for Donation has also expressed quite a bit of interest in kind of helping facilitate that. It's an ongoing conversation for sure. So we have some connection to UHN, and I think it's a matter of looking at creative ways to kind of embed those videos in the educational platforms for clinicians. But I think the desire from patients was also there for their clinicians to hear, and it was a very kind of unique experience to have that lunch and learn where the patients and their clinicians were there to build that relationship as well. So absolutely, I think it's another avenue for us to explore that more concretely. And I think the second point about a kind of ongoing post-transplant group to kind of embed arts-based methods in storytelling as almost a kind of therapeutic and way for transplant recipients and to build that community capacity and kind of limit the isolation as well would be a major impact. Yeah, so hopefully there's funding for that. Oh, yeah.
Hi, Chloe. I had I guess, yeah, I had a few questions. So over the past 2 days, there's been a lot of discussions about the social determinants of healthcare, the effects of colonialism, and trying to be more equitable with the type of care that we provide to, transplant recipients, and their donors. So, how do you plan on building trust with different communities in order to have their stories broadcasted? Because it is important to have different people from different walks of life share their stories, right? And then how are there any strategic plans to try to include stories from different people from different backgrounds within your project?
Yeah, no, that's a great question. I think so. Our participants in this study, this study is finished now, but it was a question, to kind of critically examine kind of which participants have the time and the capacity to join a research study like this that's 8 weeks, right? And so we had trouble with recruitment as well, because also some transplant recipients didn't necessarily have the energy or the capacity to engage with 8 weeks, and so these are really critical questions, as well as questioning why most participants are white upper middle class participants as well. So kind of these are definitely questions that are on our mind. I think engaging in this kind of process is a very lengthy and process that requires some trust building at the forefront. And so asking those questions to ourselves of why aren't more racially diverse people coming forward to participate in this kind of study is really critical. And so more maybe trust building at the front end of that process would be really key. Yeah. Thank you.